Welcome to the Everything Surgery podcast. Step into the operating room of ideas with the Everything Surgery podcast. Grab your scalpel of curiosity and join us on YouTube. Because in this world, knowledge is the ultimate tool. Let's dissect the extraordinary. A brief history of surgery tracing the evolution of a life-saving art. The history of surgery is a testament to human ingenuity, resilience, and the relentless pursuit of medical advancement. From ancient practices rooted in necessity to the sophisticated procedures of modern medicine, surgery has evolved over millennia into a cornerstone of healthcare. Ancient beginnings. The origins of surgery date back to prehistoric times. Evidence from archaeological findings, such as trepanation, where holes were drilled into the skull, suggests that early humans performed rudimentary surgical procedures to treat conditions like head trauma or neurological disorders. These early surgeries were often accompanied by rituals, blending mysticism with medicine. Ancient civilizations like the Egyptians, Mesopotamians, and Indians made significant contributions to early surgical practices. In Egypt, surgical tools made of bronze and written accounts in the Edwin Smith Papyrus, circa 1600 BCE, detail procedures to treat wounds, fractures, and dislocations. Similarly, Indian texts like Sushruta Samhita, attributed to the physician Sushruta, circa 600 BCE, provide a detailed account of surgical techniques, including the earliest recorded rhinoplasty. Classical era. By the time of the Greeks and Romans, surgery had gained a more systematic approach. Hippocrates, often referred to as the father of medicine, laid the foundation for surgical ethics and principles. Roman physicians like Galen advanced surgical knowledge by studying human and animal anatomy, though their reliance on animal dissection often led to misconceptions. During this period, surgical practices were limited due to the lack of effective anesthesia and antiseptics. Most procedures were performed to treat battlefield injuries or as a last resort for life-threatening conditions. Surgeons relied heavily on cauterization and crude tools, making surgery a painful and hazardous endeavor. The Middle Ages. The medieval period saw a decline in surgical knowledge in Europe due to socio-political and religious influences. The Church's restrictions on human dissection hindered anatomical studies, and surgery was often relegated to barber surgeons rather than trained physicians. However, advancements continued in other parts of the world. In the Islamic Golden Age, figures like Al-Zira'i, Al-Bucasis, wrote extensively on surgical techniques and instruments in his seminal work, Al-Tasrif. His contributions laid the groundwork for modern surgical practices. The Renaissance and Enlightenment. The Renaissance marked a revival of interest in science and medicine. Surgeons like Ambroise Paré, 1510 to 1590, revolutionized the field by introducing ligatures to stop bleeding during amputations, replacing the previously used method of cauterization. Paré's humane approach and innovative techniques were a significant step forward. The study of human anatomy flourished during this period, thanks to pioneers like Andreas Vesalius, whose work De Humani Corporis Fabrica challenged long-standing misconceptions and emphasized empirical observation. The modern era. The 19th century brought groundbreaking advancements in surgery. The discovery of anesthesia in the 1840s by figures like William Morton and James Simpson transformed surgery by eliminating pain, making complex procedures feasible. Around the same time, the germ theory of disease, championed by Louis Pasteur and Joseph Lister, introduced antiseptic techniques that drastically reduced infection rates. The introduction of imaging technologies, such as X-rays by Wilhelm Röntgen in 1895, further revolutionized the field by enabling precise diagnostics. The 20th century saw the advent of antibiotics, blood transfusions, and specialized surgical instruments, paving the way for complex surgeries like organ transplants and heart bypasses. Surgery in the 21st century. Today, surgery is a highly specialized and technologically advanced field. Minimally invasive techniques, such as laparoscopic and robotic surgery, have reduced recovery times and improved patient outcomes. Innovations in artificial intelligence, 3D printing, and regenerative medicine continue to push the boundaries of what is possible. From its humble and often brutal beginnings to its current state as a life-saving medical art, The history of surgery is a remarkable journey of human progress. Each milestone reflects the enduring quest to alleviate suffering and improve the quality of life for all. Okay, that concludes this podcast. Thank you for listening. Remember to like, share, and subscribe. Everything Surgery Podcast. Dissect the extraordinary.